Good evening. In honor of Black History Month and Women's History Month, this week's podcast is recorded, and I'm going to just review how we got in this mess. Why did we get a shortage of Black physicians? So, again, this is Public Health is Everything podcast, and I want to welcome you tonight. I want to start with a land acknowledgement. This is an important ritual that we remember that we do live and work on stolen land. This is one of my favorite quotes from Dr. King, and he's talking about how injustice in health is the most shocking and inhumane. And I think this is something we have to keep in mind when we ask ourselves, why are we as Black people dying in greater numbers? Why do other people of color, our Native American brothers and sisters, our Latinx brothers and sisters, why are people who are oppressed dying? And so we're going to look at one aspect of that. I'm going to be exploring today the history of Blacks in medicine. I want to start off by reminding us from Dr. Jones, her definition of racism. And I'm sorry this is formatted a little strangely with this streaming, but you'll bear with me. Racism is a hierarchical system that places some human beings above other human beings. It inappropriately advantages some people, in this case, white Europeans, and inappropriately disadvantages other people. In my mind, racism and capitalism are intimately linked. They're bound up together and they reinforce each other. This is where we are today. This is active physicians in the United States of America in July 2019, our most recent data. And I think the really bad thing here is when you look at this picture, this tiny little blue slice here showing that Blacks are barely above 5% of physicians in the country is a real problem. It's not the solution to have more Black doctors, but we can't make progress unless we have a workforce of physicians, pharmacists, dentists, nurses that look like the country. So I just want to stop here for a moment and recommend these books to you. You could go into much more depth of our history. This 2-volume book, An American Health Dilemma, is really a seminal work. It goes into detail on the history of Blacks in medicine in general. The Caring for Equality by David McBride is another great book that encapsulated in a couple of hundred pages the history of Black people. And for people in public health, From TB to AIDS is really an important book that you need to read and learn about the history of Public Health Week because it comes from our history. Other great books, Vanessa Northern Gamble writes a book about Black hospitals. We'll be talking about that a little bit. And even though I'm going to focus on physicians today, I am a well-trained Cook County physician, and I know the people who run American healthcare are nursing people, staff. They run the system, they outnumber us, and so that's a great book on the history of Black nurses from Darlene Clark Hines. So just to put us in how we got here, as you remember, on ships traversing the Atlantic Ocean, the slave trips. And this is just a map that reminds you of where slaves that were stolen from Africa ended up. And I want us to remember that in the context of American history, if we use the relatively arbitrary start date of 1619, I don't want my historian friends to be mad at me. We actually had some slaves in the colonies before then. But in any case, 1619 till 1863, that's 61% of the time we've spent in the United States. So when people say slavery was a long, long time ago, it wasn't as long as people think. And we've only spent about 25% in what I call the era of terror and Jim Crow, from after the Civil War to the passage of the Civil Rights Act, Voting Rights Act. And then since that time, where we've had basically a rightward neoliberal period, it's a tiny percent, about 12%. So really, most of the time we've spent in this country as a people, we have been enslaved. And the other thing that's critical, only 4 to 6 Africans who were enslaved in the transatlantic slave trade ended up in the United States of America. What does that mean in plain English? That means 90+% of our brothers and sisters ended up in the Caribbean, in Mexico, in South America, Central America, with the largest number ending up in Brazil. And just to make that clearer for you, what that means is that most African Americans, that's to say, most people of the African diaspora who have a history as being enslaved and live in the New World, do not live within the United States, and they do not speak English. They speak Spanish and Portuguese. So think carefully when we talk about what we mean when we say African Americans. Here's some other great books that I just want to take a moment to remind you of. This first book on the age of slavery talks about medicine and healing, not only during slavery in the United States, but just as I just said a minute ago, during slavery throughout the hemisphere. This is a book with a lot of interesting chapters. And finally, this relatively new book by Jim Downs talks about how colonialism, slavery, and war really transformed Western medicine. So again, these historical books are just some things you can look at when you have time. This is where slaves lived in the United States in the 1830s, predominantly in the old Confederacy, but you'll notice there's slaves in every part of the British colonies. And so don't think that only slaves were in the South. That's just not true. And this is what many people thought of us. Joshua Knott, Dr. Knott, is a famous and well-respected American physician. This quote from him, that Negro races stand at the lowest point in the scale of human beings. This is what he really thought. He wrote about, you won't be surprised to know that he founded the medical school in Alabama, and he was basically the head physician for the Confederate Army. So here is a look for people, especially in public health, as we talk about evidence-based thinking. Here's a look at some evidence from 1849. This is not Dr. Knott's work. This is basic work that was done and published in the Southern Medical Journal, a respected journal of its day. They didn't have a graph like this. They had it in a table. I don't want to mislead people, but I turned it into a graph because it's a picture. It's easier to see. So you can see enslaved women are here in the blue bar, and this red bar are white women, and they're just comparing the prevalence, how common these diseases were. So these diseases peculiar to women, those are diseases predominantly of reproductive areas, and you can see that enslaved women had a much higher prevalence, and this specifically is miscarriage. Again, you can see that the enslaved women had a much higher prevalence of miscarriage than the white women. This is the conundrum. In theory, according to Dr. Knott, the racist, slaves were supposed to be able to work in the fields, to be strong. We were supposed to have been created to be slaves, much stronger and healthier and able to work in the field than white women. So why did this problem exist? How come the data doesn't show that? And the question that was asked by the people who collected this and published it in this journal was, this early inequality, this early health inequity, is it because of the conditions of slavery? That is to say, the actual institution of slavery, or was it the constitutional conditions of the slaves, something internal to slaves? And this is their conclusion. This is a quote. You can actually Google this old article up and read it for yourself. But basically what they say here, they have a very scientifically appropriate way of thinking about it and discussing it. They say, look, this evidence that we just showed you is different than what we think. And the question is, why does this difference occur? Is it because slave labor is inimical to the procreation of the species? And they even list obvious reasons why that might be true, because of exposure to the elements, violence, exercise, or something secret that the slaves did internally, as they say in this quote. And here in red was their conclusion. We are led to the conclusion from the facts within our knowledge that it originates from the unnatural tendency of the African female to destroy her offspring. So when we think about evidence-based, we have to understand that evidence is something that is a judgment on what you see in the world. Who gets to define what is evidence, and who gets to define what the conclusion is from that evidence? Nonetheless, American physicians, in large measure, contributed greatly to the building of scientific racism, which we don't have time to talk about in depth. Here's a collection of skulls from Dr. Morton. You can see he collected these in the decades before the Civil War started, and he, along with other scientists, measured these skulls and tried to prove from these measurements that Africans were at the lowest rung of the hierarchy, and there was, Caucasians and Mongolians in his mind were the most intelligent. So these skulls still exist today, and this picture is a modern picture, even though they were collected before the Civil War. So the concept that comes to us from scientific racism that blacks were biologically inferior is a long-standing concept. But I don't want you to think that they were unopposed. There are lots of people, white and African, who opposed these ideas. We'll talk a little bit about some of them. But there were specialists in the health of black people back in the day in the South. They supported slavery in the main, and they invented new diseases. Like, I like this great disease, drapetomania, the disease causing slaves to run away. And they thought one of the problems with that might be excessive kindness. So during slavery, the health of the slaves were certainly in jeopardy compared to free people that were not mistreated, that had better diets, and were treated like human beings. The conditions were horrible. But the actual status of American medicine was bad during those periods. So I can't really say that we got significantly different or worse medical care than white people, because the general level of medical care was so bad. In our history, there have been three major types of physicians, and I want to do deference to them. First, and the largest number, especially before the Civil War, and even for many decades after, were people that were trained as herbalists or indigenous trained. There was a cross-fertilization between Africans and the knowledge they brought from the mother country with Native Americans, and so those were the most numerous. The second group that we'll talk about are the people that were trained as apprenticeship, and third and finally, the people who were formally trained in Western medicine. So quickly, probably some of the most famous herb physicians were slaves. Caesar, that's all we know about his name. He actually, in the 1700s, created an antidote for rattlesnake bites, so much so that the South Carolina legislature gave him his freedom and paid him $100 a year. Think about how much money that was back then. $100 a year for making this important discovery. And hopefully you've heard of Omniposus, who was a slave of Cotton Mather, another early slave-owning physician, and explained to him that in Western Africa, there was a process of taking cowpox and deliberately infecting human beings with it so that they wouldn't catch smallpox, which had a much higher mortality. This process actually was widely used throughout Africa, India, and China. It's just something that the Western Europeans didn't know about. So that was the largest group. But let me move quickly to the apprenticeship trained and say these are how most American physicians were trained really until the 1900s, certainly till after the Civil War, but in large measure till the 1900s. And what that is, that they went to someone else who was working as a physician and worked as their apprentice. And this wasn't formal, so you might be there for a month, you might be there for 6 months, whatever. And what happened with most of our African-American physicians is that they were often slaves of white physicians and therefore learned how to become physicians as a slave. This is a sketching of David Ruggles, who was born one of the rare apprenticeship trained people that was born free. He was not a slave, but he was active in the abolition movement, as you'll see many of these physicians were. Then we're going to talk about David McDowell, this is James Durham. I'll come back to David McDowell in a minute. James Durham is another famous apprenticeship-trained physician. He started off as a slave. He was able to work and buy his freedom. He had a large medical practice in New Orleans, and he was very instrumental in understanding medical care. He did meet Dr. Rush, again, one of the American physicians that signed the Declaration of Independence. And he actually was considered as well trained as most American doctors with an active and vigorous practice. David McDowell, this is what I wanted to talk about earlier. David McDowell was a slave, and his slave owner, John McDowell, had a bet. He felt that David and another young man that he owned were very intelligent, and he sent them off to college to prove that they were intelligent. They were there for about 6 years, and the plan was for David McDowell to be forced to go back to Liberia. But Brother McDowell said no, he wasn't going back to Liberia. He was active in the abolition movement, and he insisted on getting trained as a physician. And so he was able to go to New York and train as an apprenticeship in New York City. And actually, he attended classes at the College of Physicians and Surgeons. But he was not allowed to get a diploma. They didn't want to admit that he had attended classes, but he was hired by John Rogers, his mentor and the person who trained him, to work in the New York Eye and Ear Infirmary. So in many ways, I consider David McDowell the first Black ophthalmologist. He worked at that Eye and Ear Infirmary for over a decade. In 2018, Columbia University College of Medicine finally posthumously gave him a diploma. John Sweat is another one of our apprenticeship trained doctors. He actually was trained as a doctor and a dentist. He tried to get into medical school, but he was denied entrance because he was Black. However, he was admitted. He became an attorney. In addition to being a doctor and a dentist, he became an attorney. In 1861, he was admitted to the Massachusetts bar. And don't forget, the Supreme Court is in D.C. So by an act of Congress after the Civil War, by what's called the Radical Republicans, he was the first Black admitted to the bar of the Supreme Court after the 13th Amendment was passed. So he's another very famous and important abolitionist and anti-racist in our history. Martin Delany is another apprenticeship-trained doctor. You can see him in his military uniform as he fought in the Civil War. He co-founded the North Star newspaper with Frederick Douglass. He was actually admitted to Harvard Medical School along with two other Blacks and a woman. But the white students organized, you can see there in red, they did not want to allow these students to come to school with them. And so they were dismissed from Harvard Medical School in 1851. The first Black to actually graduate from an American medical school in 1847 was David Jones Peck. And he went to medical school here in Chicago at Rush Medical School. He was a protege of Martin Delany. He was active in the anti-slavery movement and the abolitionist movement, but he didn't stay in the United States to practice. So during this time of scientific racism that especially the pro-slavery physicians fought for, we had people who argued against that. We had many white scientists from Europe, from Germany, from England, from the United States who said this idea that Blacks were biologically inferior was simply wrong. They were a minority, but they were there and they spoke up. Other scientists, as I said, Dr. Rock argued against it, and we're going to talk about Dr. James McCune Smith in just a second. He argued against scientific racism also. Dr. Smith is actually the first African that we know of that was trained in Western science at all. We'll get to his slide. He did a number of studies, this particular study of rickets, where he controlled the study populations and showed that the real problem with rickets is people were poor, not that they were Black or white. There's Dr. Smith. Dr. James Smith, you can see that he was born of a free mother and an ex-slave. He was denied admittance to college. So he had to go to Glasgow to earn his bachelor's, master's, and MD in 1837. As I said, he's the first Black doctor in the U.S. with a formal medical degree. He's a founding public health leader. He's a founding member of the New York Statistics Institution. He's a major abolitionist leader. In 1840, the U.S. Census tried to say that they had proof that if you were a free Black, your chances of being insane was 10 times more than if you were enslaved Black. And he actually used his statistical training and skills to prove that that was completely wrong and absurd. He was denied admittance in the 1800s to the New York Academy of Medicine, again, a prestigious organization, because he was Black. And so in 2018, just a few years ago, the New York Academy of Medicine decided to finally admit him into membership. So the Civil War erupts, chattel slavery is abolished. And again, the thinking of many American doctors were that blacks would just die out. Their position was we were incapable biologically of being free. And so many people, like Dr. Knott, said we don't have to worry about them. Once they're emancipated, their health will deteriorate and they will simply die out. But fortunately, as we know, that didn't happen. There is no science to their scientific racism. And after the Civil War, the Freedmen's Bureau was set up. It was an organization designed to address the needs of former slaves. Think about a population that was denied the ability to read, were underfed, overworked, couldn't own any property, and suddenly you're released. So this Freedmen's Bureau only existed for 4 years. They set up a number of hospitals. You can see 90 mostly throughout the South. They employed close to 200 doctors and several hundred hospital attendants. The largest and surviving remnant of that sits at Howard University, Freedmen's Hospital, the teaching hospital for Howard University for many years. Again, I'm sorry for the slides being confused, but you'll see some other things. In 1860, there were only 9 white schools that admitted black students. But again, after the Civil War, the first black medical school that's established in 1868 is Howard Medical School. It was part of the Freedmen's Bureau. It admitted all races from the beginning, and it also admitted women from the beginning. This is a mistake here. By 1890, not 1990. By 1890, they had already graduated some 500 doctors, 35 women, and 10 white folks were graduated by then. The second medical school that was started, the black medical school, is Meharry Medical College in 1876. It was part of Central Tennessee College, donated by these Meharry brothers who donated the land. They were Irish immigrants, and they donated the land. Unlike Howard, Meharry admitted its first first white student in 1957. Meharry was not part of the Freedmen's Bureau. They didn't have any support from the federal government, and so they struggled financially for decades. They were always the poorer of the two schools. For a long time, they had no formal clinical training. They would sometimes with the faculty on house calls. Some faculty used their basement or parts of their houses to try to do the training. This is Dr. Hubbard, for whom the Meharry Teaching Hospital was named after. They tried to get access to Nashville's City Hospital, where 50% of the patients were black. I want to remind you that Vanderbilt Medical School, also there in Nashville, had access. And so this fight went on for years. Even when I had the privilege of being on Meharry's faculty years ago, Dr. Satcher was still fighting for equal access to the City Hospital. But in the 1900s, finally, a hospital for Meharry is established. It had 80 beds when it opened up. But there were other medical schools, not just Howard and Meharry. Here's one of the largest that we had, Leonard Medical School at Shaw University. They were the first school, one of the first schools in the country to adopt a 4-year curriculum for medical school. Here are the facilities that existed in 1912. And I will tell you right now, these facilities were better than the vast majority of white medical schools in the country. They had a specific building for lectures. They had an amphitheater. They had dissection room for anatomy. They had laboratory facilities, and then they had a hospital with 80 beds. It was really one of the better staffed and equipped medical schools in the United States during this time period. Here's another one of the largest schools that existed, Straight Medical School, Straight Medical College. And I can't remember if this was in Tennessee or not. It was formed by the state legislature. 10 students were enrolled, but they had no clinical training, so they didn't have any graduates. Flint in New Orleans is just another example of one that opened up. So let's just look at this real quick, and we'll have another couple of slides that you can look at it more carefully. On this left side are the white schools that admitted black students before the Civil War. A lot of these schools no longer exist, but you can see them listed here. Harvard, Rush. Oh, I'm sorry. Let me go back here. And here on the right are black medical schools that were set up during Reconstruction. And we're going to look at those a little more carefully here. I want to remind you what happened during Reconstruction. When the 13th Amendment passed, it abolished slavery unless, except as it says here in red, as punishment for a crime. And so slavery did not get abolished as cleanly as we would like. So we really had slavery by another name. This is just a picture of some folks that are being used as convict labor. So we really still used as labor throughout the South in the agricultural regions, mining, in the coal mines around Birmingham, and the steel mills. Um, if you did not have a job, if you couldn't show that you were contractually obligated to some white person, you could be jailed, and then you would have to work for free. You could only have one contract a year. You couldn't go to another job if they offered you to pay more. So there were systems in place to guarantee that the newly emancipated slaves could not really function as though they were free. And this is one reason why 7 million blacks fled. Almost half the population of the South fled the South as Reconstruction is demolished. And it was demolished by pure, simple terrorism and these structural laws that pinned people in. But here are the medical colleges that were set up during Reconstruction, listed in the order that they were established. You can see Howard and Meharry there. You can see the other ones that no longer exist. We have another slide of those folks. So this is a lot of schools. So basically, 14 schools, at least, that we know about, were established during the period of Reconstruction, Black medical schools. Only 10 of these 14 produced graduates. And as we know, only 2 survived into the 1920s. And through the end of the 60s, Howard and Meharry accounted for the vast majority of Black physicians. Rebecca Crumbler is the first Black woman to graduate from medical school in 1864. At this point in time, they had all women medical schools, and she went to the New England Female Medical College. She wrote a book that still exists today, one of the very first medical publications published by an African-American physician. She worked in the Freedmen's Bureau as a physician, and she practiced in Virginia, in Richmond, Virginia, and Boston. This article, this is from the Boston Medical Surgical Journal, which is really the New England Journal of Medicine today. This was published in 1904. This is part of this notion about the slavery. And this is an article in that New England Journal saying that slavery was good, that Blacks that were enslaved had nothing to worry about, had no stress, and everything was fine. And freedom, on the other hand, was bad. Why? Because they saw an increase in tuberculosis. That's what consumption is. An increase in tuberculosis and insanity among Southern Negroes is due to being free. This is a publication in the most prestigious medical journal in 1904. So they felt again that our health problems were because we were Black and because of biological inferiority. This is Rebecca Cole, or at least a drawing of her. This is the second African-American woman to graduate from a U.S. medical school. And she worked with Elizabeth Blackwell in New York, but I have her there for a reason. The great W.E.B. Du Bois felt that tuberculosis among Blacks was a problem, partially because of ignorance of hygiene, and he was really concerned about this. Dr. Cole disagreed with Dr. Du Bois and blamed slum landlords. So you could see even in these early decades, there was a vigorous discussion about health inequities and what caused them. So we had these 14 schools chugging along, even though Reconstruction was pulling us backwards and undermining our ability to be emancipated. But while this was going on, American medical education was in trouble. The Association of Medical Colleges was formed in 1890. It was a small group of colleges, and they were trying to make medical education in the United States more scientific. It's not until 1893 that Hopkins adopted the 4-year curriculum after Lincoln. The AMA is formed in 1847, before the Civil War, but again, it's a small group, mostly of European-trained doctors at that point in time, because don't forget, most American doctors are trained as apprenticeship, and they were worried about the problems in a medical education. So the AMA approached the Carnegie Foundation to try to address this problem, and the Flexner report gets formed. This is Abner Flexner, who was hired to do a survey about this report. This is the just the title page for the Flexner report, and I think it's important to understand that this report did have a radical transformation of American medical system. The principal findings of this report were that there were too many medical schools, and the physicians who graduated from them were poorly trained. They said 90% of the schools had inadequate standards. Most of them didn't have a faculty. They didn't have enough courses. They were just horrible institutions. And they recommended that all the medical schools for women be closed, and that women should go to the men's schools. And they had a special chapter on the Negro medical education. This is how the shortage was created. They said that the practice of Black physicians should be separate. He argued that Negro doctors should be sanitarians. In other words, they shouldn't be trained the same way white doctors were trained. He suggested that they close at that point in time. When he did his survey, there were 7 remaining schools out of that 14. So we added 14 that went down. Half of them closed for financial and other reasons during Reconstruction. There were 7 operating when he started his survey. 5 of the 7, he said, should be shut down. And he even clearly stated which 2 schools should survive. You won't be surprised. Howard and Meharry, he said, should survive, though they will be unequal to the need. So when this report gets written and published in 1910, it's very clear that he's saying we should close all the Black medical schools except for Howard and Meharry, and we should, but we know they won't be enough to meet the needs of the Black population. So this report had such an impact because after the report gets published, hundreds of millions of dollars are invested in American medical schools to bring them up to European standards. The white medical schools were funded first. Howard and Meharry really didn't get any money until the 30s, and so they continued to struggle financially. Here's the impact of the Flexner report. We saw a decrease in the schools because don't forget, most of these schools were just sham schools. They weren't real schools. This is the actual decrease. This is what he recommended. He wanted to go down to 31 schools. That got up to about 80 or so. So it did go down significantly, not quite as much. For the white schools, 40% of the total schools were closed for white medical schools. For the African-American schools, the Black medical schools, 71%, 5 of 7 ended up being closed. So he argues in a way a liberal argues. He says, Black doctors are never going to only take care of all Black people. But Black doctors shouldn't touch a white patient. That's a quote there. So he didn't think Black doctors should touch a white patient. But he did make clear that at that point in time, 1910, there were 10 million Black people in the United States living among 60 million whites, and that we are a source of contagion, that we could infect the white people for whom we worked. And so for that reason, he says we should keep Howard and Meharry open. They are, of course, unequal to the need and opportunity. Well, Black physicians didn't take this lying down. This is from the Journal of the National Medical Association, the Organization of Black Physicians, and they were quite critical of this report at the time. They lambasted it in the journal in their editorials, and they said that Flexner was trying to create a second-class group of physicians and trying to limit the ability of Blacks to practice and provide for health for our people. So we have a situation of a civil war, the emancipation and end of chattel slavery, but reneging on that promise with the imposition of terror and Jim Crow and undermining of Reconstruction. And so the 14 medical schools that are established after the war during Reconstruction with hope and promise of a better future dwindles down to half that number, 7 by the 1900s. And then we have this effort on the part of the AMA and the AAMC to reform American medical education And in the process of doing that, they make a recommendation, which they implemented, to only allow 2 Black medical schools. And while that's going on in the medical education part, I want to take a moment and talk about what's going on among practicing physicians. So this is a tale about organized medicine. Again, after the Civil War, 1869, there's a medical society in District of Columbia in Washington, D.C., that is organized and controlled by Congress. Congress runs D.C., don't forget, so they're the ones that give the charter. And 3 Black physicians, 2 of whom were faculty at Howard, apply for admission to the Medical Society of the District of Columbia. They're denied because they're Black. And so this actually causes a senatorial investigation. So these are pictures of two of the 3 Black doctors that were denied admission. And there was a Senate hearing on it. And also in 1870, the faculty at Howard, they didn't just wait for this to get resolved. They made a professional body. They sort of made a new National Medical Society of DC that was integrated, that included faculty from Howard and also Georgetown. Basically, they went to the American Medical Association convention. They said the integrated medical society and the segregated one, and they both wanted to get seated at the AMA, and the AMA refused to seat the integrated one. They excluded a delegation with Black members. They admitted the all-white delegations, and they said this is a decision of the local society. The Senate investigation, the U.S. Senate investigation, indicated that this was just plain and simple discrimination, and they tried to take away the charter of the all-white organization, but that didn't go very far. But the Senate investigation clearly shows that this is just racial discrimination. Here's some comments from the 50s, because this was still going on in the 50s, the exclusion of Blacks, especially from the Southern AMA chapters. Some of the Northern chapters did admit Blacks. This says the continued exclusion of Negro physicians is an international disgrace. And she's arguing that the AMA's claim that they can't address the situation is wrong and just part of racism. So like I said, Martha Mendel is a white physician calling for this to stop. This is what happened in the late 1960s. This is a picket line before the American Medical Association, calling on the American Medical Association to insist on integrated chapters, to not allow local medical associations to discriminate purely on race. I want to call out some of our ancestors on whose shoulders we stand today. Fortunately, I had a chance to meet all 3 of these gentlemen. This is John Holloman, a leader in the New York health and hospital system. This is Robert Smith, Dr. Smith, one of the few practicing physicians in Mississippi, a real leader in the civil rights movement, and in this movement to try to address AMA. And this is Walter Lear out of Philadelphia, a leader of a gay physician leader for gay rights. So this is in the late 60s. I remember when this picket line happened, and it's just how long it took the AMA to even do anything. But in any case, Black physicians organized our own medical associations. These are some of the early ones, of course, ending up with the National Medical Association, the association that we have today. In 1895, that was organized, and in 1909, the journal has been publishing since then. This is the health status of Black people in 1920. Not very good. You can see the gaps compared to whites. Unfortunately, still the same tale. And we, in addition to establishing medical associations of our own, we had to establish segregated hospitals of our own too. And there are basically 3 types of Black hospitals that existed. The ones that were segregated, like Homer G. Phillips in St. Louis, that were established by whites in the South. The ones that were Black controlled, for example, Provident Hospital in Chicago, and Provident was started to help train nurses, and the ones that just demographically became Black for a while, like Harlem Hospital. I don't have time to talk about Black nurses, but I can't give a slideshow. This is Mary Elizabeth Mahoney, the first professional Black nurse in the U.S., really an important figure in the history of healthcare for the United States. So a number of our hospitals were designed to train nurses. This is Flint Goodrich in New Orleans, set up to offer a place for Black nurses to get trained. But we lost our hospitals. In 1944, there were 124 Negro hospitals in the United States. Today, well, it depends on how you want to count. Maybe Howard University. I mean, it's really, we really have lost that. This is just history for those of us in Chicago about Providence Hospital, which officially closed in 1987 as an independent Black hospital. It was reopened by Cook County government. This is Dr. Austin Maurice Curtis, who was the chief surgeon at Freedmen's Hospital at Howard, but he's the first intern at Providence Hospital in 1891, and he's the first Black surgeon on the staff of Cook County Hospital in 1896. So we have a reformation of American medical education, the development of specialties for physicians, and in 1931, there were 25,000 specialists in the United States, only 2 of which were Black. This is because, and here they are, Daniel Hill Williams in the College of Surgeons and William Barnes. And this is because Blacks were not permitted to be interns unless they were at a Black hospital, and they were not allowed to get training in specialties. Paul Corneli is really an important figure here. I wanted to put this biography up of him a little bit. You can see his years here. He is the first doctorate of public health in America out of the University of Michigan. He's the first Black to earn a doctorate, a PhD in anatomy. He was the chair of the Department of Preventive Medicine at Howard Medical School for decades. He's the founder of the Black Caucus, one of the founders of the Black Caucus of APHA. He's the first Black president of the American Public Health Association. He's the first Black president of the Physicians Forum, one of the founders of the Medical Committee of Human Rights. His predecessors were abolitionists. Dr. Corneli organized the medical support for the famous March on Washington. But his academic work, he looked at the status of Black doctors in 1932. And so here's a pie chart. Here's where, at that point, Blacks were 2%, 2.5% of all physicians. And you can see here, 69% of all Black doctors in the United States in 1932 were graduates of Howard and Meharry. 6 were unknown. 11% were graduates of the legacy schools. In other words, those other schools that disappeared during Reconstruction and after the Flexner Report. And 14% were graduates of white institutions. So we can see here, as we look in the blue, these are changes in the population. You can see the changes in the Black population, and you see these numbers going down for how Black physicians were trained. So basically, after the reform of medical education, we have the country entering the Depression years, and between 1900 and 1920, Black physicians doubled because of the graduates from the legacy schools and Howard and Meharry. We reached a high point until very recently in my lifetime in 1920, where we were almost 3%. Of course, we're almost 6% now. And this appears to be the golden period. But during the 1930s, Howard and Meharry were in major financial trouble, and more Black physicians died than graduated from Howard and Meharry. So that's where we really began to lose ground, because the number of Black people in the United States was increasing. The economic condition of Howard and Meharry was decreasing. The medical class sizes could not grow and often shrunk. And so starting from the 1920s through the 1930s and really into the 1940s, there were many years where more Black physicians actually dropped dead than graduated from Howard and Meharry. 2008 is an important year, and we're coming up to the modern day. I remember this year for 2 reasons, 2 things I thought I would never live to see. First, the election of a Black president of the United States. This is the year that Barack Obama was elected. And the second thing which was even more shocking to me than the election of a Black president, is a public apology from the American Medical Association to all Black physicians and all Black people, where they admitted that it was their racism that helped cause the health inequities that we see today, the unnecessary deaths, that their policies were racist to begin with, and there was a whole process for this apology. So we have an apology in 2008, but where are we? At the beginning, I talked about the fact that we are not yet at 6%. 5.8% of all physicians are African American. Since 1980, the number of physicians has doubled between 1980 and 2010. I graduated from medical school before 1980, so we've seen the number of physicians actually double. The proportion that are women has certainly increased. And in our medical schools now, the classes are almost 50-50 generally. Since 2002 up to 2018, here are all the new medical schools that are in process here. So we've added to our medical school grouping, and we've added 26 medical schools and 14 schools of osteopathic medicine. But still, and this data is between 1980 and 2012, if we just look at where have Blacks graduated from since 1980, the biggest schools are still, here's Howard, here's Morehouse, here's Meharry. So Howard and Meharry are still number 1 and 2. And there are many schools that are huge before them. University of Illinois, my alma mater, one of the larger medical schools, is there. Wayne State, Morehouse. So there's still a small fraction of schools in the country that are producing the largest number of Black physicians. You have to ask yourself, what would happen if Howard and Meharry got in big trouble and couldn't do it? Here's a look, a snapshot for 1 year, a recent year. This happens to be the year 2018 and 2019. The percentage of applicants, these are not people that are accepted. These are applicants and where they're coming from. So you can see here, 44% are identify as African American. Here's 16% who identify as African. This 8%, almost 9% Afro-Caribbean, multiple groups. So again, where our students are coming from has shifted over time. This is a look at full-time medical school faculty. We're this little tiny slice here, 3.6%. It's really hard to produce physicians when you only have 3.6% of the faculty. If we talk about what's going on with our medical students, if we talk about what's going on with our Black men in medicine, and we don't have data on this, what's going on with Black men that get through medical school and enter a residency? How many of them get to finish their residency? Not as high as I think it should be. So, in spite of this hundreds of years of work in healthcare, in spite of the fact that we've been actively involved in the practice of medicine in the United States and the development of inventions and the scientific frontiers of the field, in spite of the fact that we've successfully, I hope, beat back the notion that we're biologically inferior, we find ourselves here today in 2022 in not much better position than we were when the Flexner report first came out. And it's distressing to me as a retired Black physician to say that the number of Black men entering medical school today is less than the number of Black men that were in medical school when I was there. This is a major problem. So in order to demand justice, in order to address pipeline programs, in order to insist that we fight against this racism, we have to start by knowing our history and understanding our history. And when we do that, then we're in a better position to change the things that need to be changed. So thank you so much for listening to this brief overview of the history of Black physicians in the United States. And I look forward in future podcasts to discussing this and other issues with you. Good night.